Welcome to the London Dermatology Centre podcast, everyone. Today, we've got a fantastic guest with us, Dr. Alla Altayeb, a consultant dermatologist right here at our Wimpole Street Centre. Dr. Altayeb, it's a real pleasure to have you. We're here to talk about something incredibly important and often quite challenging in primary care, psoriasis, and your upcoming masterclass on the topic.
Thank you, David. It's my absolute pleasure to be here. I'm really passionate about this topic and excited to share more about the upcoming session we have planned for GPs.
Excellent. Now, Dr. Altayeb, you're hosting a masterclass titled Psoriasis Uncovered, Recognition, Referral and Management in Primary Care. Could you tell us a bit about yourself first, and then what prompted you to create this specific event for general practitioners?
Of course. As you mentioned, I'm Dr. Alla Altayeb, a consultant dermatologist here at the London Dermatology Centre. My focus has always been on complex inflammatory skin conditions, and psoriasis is certainly one of the most prevalent and impactful. Over the years, I've had countless conversations with GPs, and a recurring theme is the struggle with psoriasis. It's a condition that truly tests primary care clinicians.
That's really insightful. So when you say struggle, what are some of the key challenges GPs are facing with psoriasis management in their daily practice? I mean, it's a common condition, but perhaps not always straightforward to deal with.
Precisely. The main issue is its sheer variability. Psoriasis isn't a one-size-fits-all condition. It presents in so many different ways, from small persistent plaques to widespread erythrodermic psoriasis, or even affecting joints in psoriatic arthritis. This varied clinical presentation can be incredibly confusing, especially when you're seeing a diverse range of conditions daily.
So it's not just about diagnosing the rash, but recognizing the nuances of how it appears, right?
Absolutely. Beyond that, GPs often tell me they're unsure when to refer a patient to secondary care. There's a fine line between what can be effectively managed in primary care and when specialist input is truly needed. And then there's the pace of change in treatments. Keeping up with the latest treatment options and emerging therapies, particularly biologics and targeted treatments, is a huge challenge given their busy schedules.
I can only imagine. The landscape of medical treatments evolves so rapidly. And I've also heard that psoriasis isn't just a skin condition, it can have other health implications. Is that something that often gets missed?
You've hit on a crucial point, David. That's actually one of the biggest areas where I see opportunities for improvement. The comorbidities associated with psoriasis are often overlooked. We're talking about conditions like psoriatic arthritis, metabolic syndrome, cardiovascular disease, even psychological impacts like depression and anxiety. These can profoundly affect a patient's quality of life, and if we don't screen for them proactively, we're missing a significant part of the picture.
That's a powerful statement, missing a significant part of the picture. So this masterclass is really designed to bridge those gaps and give GPs more confidence and tools, isn't it?
That's exactly it. This session is specifically designed to address these challenges head-on. My aim is to equip busy GPs with practical, actionable knowledge that they can implement immediately in their practice. We want to empower them to feel more comfortable and competent when managing psoriasis patients.
Fantastic. So let's dive into what attendees can expect. What are some of the key takeaways or specific areas you'll be covering during this interactive masterclass?
We'll cover several vital areas. Firstly, I'll be sharing how to recognize the full spectrum of psoriasis presentations. This goes beyond just the classic plaque psoriasis, touching on scalp psoriasis, nail psoriasis, inverse psoriasis, and those more challenging forms like pustular or erythrodermic psoriasis. Understanding these variations is crucial for accurate diagnosis.
That sounds incredibly comprehensive, so GPs will leave with a much sharper eye for identifying different types. What's next on the agenda?
Next, and this is so important, we'll discuss the key comorbidities every GP should screen for. I'll provide practical guidance on how to easily integrate this screening into their routine consultations, ensuring a holistic approach to patient care. It's about not just treating the skin, but seeing the whole patient and anticipating potential related health issues.
That makes perfect sense. Preventing or managing those associated conditions early on could make a huge difference to a patient's long-term health, not just their skin. And then, once they've identified the type of psoriasis and screened for comorbidities, what about the actual management?
Absolutely. We'll then move on to practical and efficient management strategies for use right there in primary care. This includes optimal topical therapies, when and how to use them effectively, and general lifestyle advice that can significantly impact a patient's condition. My goal is to make these strategies easy to implement even within a busy clinic schedule.
Efficiency is key for GPs, I know, and I imagine sometimes, despite all the best primary care efforts, specialist input is needed. Will you be addressing that when to refer questions specifically?
Definitely, that's a major component, providing clear referral pathways. Knowing exactly when specialist input is needed can save both the GP and the patient time and improve outcomes. I'll outline criteria and scenarios where referring to dermatology is the best course of action, and what information would be most helpful in a referral.
That sounds incredibly helpful for anyone working in primary care. And you mentioned keeping up with new treatments earlier. Will attendees get an update on the very latest in that field?
Yes, of course. We'll cover the latest advances in biologics and targeted treatments. These therapies have truly revolutionized psoriasis management for those with more severe disease, offering hope and significant improvement for patients who previously had limited options. I'll provide an overview of what's available and who might benefit.
That's fantastic. It's reassuring to know there are constantly new options emerging for patients. And beyond the formal presentation, will there be an opportunity for attendees to engage directly with you?
Absolutely, David. This is an interactive masterclass. We'll have a dedicated live Q&A session so attendees can bring their own cases, their burning questions, and we can discuss them together. It's a chance to apply the learning directly to their real-world scenarios, which I think is invaluable.
That's a brilliant opportunity for direct learning. So, for those busy GPs listening, how can they join this incredibly valuable session? Can you give us the logistical details, including when it is and how they can sign up?
Certainly, the masterclass is scheduled for Thursday, 30th October from 6 to 7 p.m. We've made it really flexible to accommodate busy schedules. You can join us either in person, right here at the London Dermatology Centre on Wimpole Street, which is a great opportunity to network and experience our clinic firsthand, or you can join us online from the comfort of your home or practice.
So, both in person and online options. That's excellent for accessibility. And for those who are always looking to develop professionally, is there any accreditation associated with this masterclass?
Yes, absolutely. This is a CPD accredited session and it's worth 2 CPD points. We understand the importance of continuous professional development for GPs, and this masterclass is designed to contribute meaningfully to their dermatology expertise. It's a focused hour that really packs a punch.
2 CPD points for an hour of highly relevant practical learning. That's a fantastic return on investment for their time. And Dr. Altayeb, is this masterclass part of a broader educational initiative at the London Dermatology Centre?
It is, David, and I'm glad you asked. This Psoriasis Uncovered masterclass is one of a series of educational events we're running. These masterclasses are expertly organized by Dr. Chopra, our CEO and founder of the clinic, with the specific aim of fostering a stronger link between primary and secondary care. We believe that by enhancing the knowledge and confidence of GPs, we can ultimately improve patient outcomes across the board. So, keep an eye out for other topics coming up.
That's wonderful to hear that there's a wider commitment to empowering GPs with specialised knowledge. It truly sounds like Dr. Chopra and the whole team are dedicated to this educational outreach. So, to reiterate for our listeners, how exactly do they register for your psoriasis masterclass?
They can register very easily through the London Dermatology Centre website. Just navigate to our events or education section and you'll find all the details there, along with the registration link for both the in-person and online options. We'll make sure the link is prominent and easy to find. It's really straightforward.
Perfect. And for those who might be considering attending in person, what's the benefit of coming to Wimpole Street compared to joining online?
Well, an in-person attendance offers a unique experience. Beyond the presentation and Q&A, you get to immerse yourself in the clinic environment. It's a chance to meet colleagues, network with other GPs who share similar interests, and potentially engage in more informal discussions. There's a certain energy that comes from being in the same room, which can really enhance the learning experience. Plus, it's always nice to step away from your usual environment for an hour of focused learning.
I can definitely see the appeal of that, the networking and the atmosphere, but for those who genuinely can't make it to Wimpole Street, the online option still offers the full educational content and the live Q&A, right?
Absolutely. The online experience is designed to be just as engaging and informative. You'll have full access to the presentation, the ability to ask questions in real time during the Q&A, and receive your CPD points. We want to ensure that geographical or time constraints don't prevent anyone from benefiting from this crucial information. So, choose what works best for you.
That's incredibly thoughtful to offer both avenues. So, just to recap for everyone, Dr. Alla Altayeb's Masterclass, Psoriasis Uncovered, is on Thursday, 30th October from 6 to 7 pm. You can attend either in person at the London Dermatology Centre on Wimpole Street or conveniently online. It's a CPD accredited session worth 2 points, and it's designed to give busy GPs practical strategies for recognising, referring and managing psoriasis. Dr. Altayeb, thank you so much for shedding light on this vital topic and for inviting our listeners to what sounds like an invaluable event.
Thank you, David, for having me. I truly hope many GPs will join us, whether in person or online. It's a fantastic opportunity to enhance your dermatology expertise, and I'm really looking forward to a lively and insightful discussion.
We encourage all general practitioners to visit the London Dermatology Centre website for full details and to secure your spot. Don't miss out on this chance to learn from Dr. Altayeb and enhance your care for psoriasis patients. Thanks again, Dr. Altayeb, and to our listeners, thank you for tuning in to the London Dermatology Centre podcast. We'll catch you next time.